coming up on the Doctor's Hospital podcast.
But many people have lost very important people in their lives, some around Christmas time, because this is a time where you're accustomed to getting together with family and friends. That's when you will miss people even more.
Are you seeking exceptional healthcare beyond the traditional hospital setting? Introducing Doctor's Hospital Clinics, your trusted destination for comprehensive care. Our full-service locations provide affordable services through our Loyalty Advantage membership program and NHI. Experience seamless care with our integrated health system, where your medical history travels with you, ensuring continuity of care. Book an appointment today at clinics.doctorshosp.com. We make primary care easy.
Hello, everyone. My name is Eddie Russell. I am the Learning and Development Specialist within the GLOW office within Doctor's Hospital, our hospitals and organizations wellness solution. And welcome to the Doctor's Hospital podcast, where we connect public health issues to what we do in the Doctor's Hospital health system. Today, we are on part 2 of our holiday health series, the last one for the year. And we're talking about mental health during the holidays. In studio today, I have the lovely Dr. Rashida Brown-Clarke, and she is a psychiatrist within our system, stationed at Doctor's Hospital West. It's an honor. I love talking about mental health. I love people who know about mental health. So welcome to the show.
Thank you for having me. Thank you so much.
I think just as a general kind of question, I want us to make a distinction between what a psychologist does and what a psychiatrist does. I think there needs to be, they sound very similar, but they do very different things.
Definitely.
So would you mind going through what the distinction is between both of them?
Okay, so a psychiatrist is actually a medical doctor. So I'm a medical doctor trained in medicine. And just like you would have a surgeon that would go on, just to specialize in surgery, or an internist specializes in internal medicine. The psychiatrist would specialize in psychiatry, which is the treatment, primarily medical management of severe mental illnesses. So I can prescribe medications.
Okay.
The psychologist is not a medical doctor, but a specialist in their own right, and you can have somebody go up to a PhD in psychology, clinical psychology. Well, there are different types of psychologists, but clinical psychologist is the person that you probably think of a bit more when you're talking about working hand in hand with the psychiatrist and being able to diagnose, because they can diagnose as well. However, they cannot prescribe medication, but they are the experts and specialists when it comes to different talk therapies. So I often tell people, they will, well, can't you do both?
I probably
no, I
can.
actually, I actually can't. I'm not trained to do what the psychologist does.
Yeah.
And so I will tell patients that I can do some very brief kind of supportive work with them.
Yes, for sure.
But when it comes to specific types of therapies, talk therapies, that is the psychologist.
Yeah, I think as we try to just generally within this country, try to unmask the hidden veil, or unmask the veil or remove the veil of mental health within this, I think it's always important to have those distinctions outlined, especially when we talk about this type of conversation.
Yes.
What are some of the most common mental health challenges people face during the holidays, would you say?
So for some people, this is a time of grieving, actually, because it is a time where we routinely get together with family and friends. But many people have lost very important people in their lives, some around Christmas time, some at any other time in the year. But because this is a time where you're accustomed to getting together with family and friends, that's when you will miss people even more. So definitely grief, but there is anxiety and quite a lot of anxiety and depression that can
Mm-hmm.
come with the holidays, because you can have in some um, aspects you can have complicated grief,
Mm-hmm.
which would mean that the person would go on to develop major depression or develop a significant anxiety disorder as a result. So those would be some of the more common things that you would see around the holidays. Also, substance abuse. So
Mm-hmm.
a number of people drinking a lot more than they should be. A lot of people abusing any number of illicit substances in order to make it through the holidays and to feel good. Well, they think they feel good or feel better during the holidays, but do a lot more damage. Yeah.
Do you find that the holidays tend to trigger a lot of these things? Like, have you ever seen where a person would have been fine all year and then during the holidays something just shifts?
Well, I remember years ago when I worked on the wards, or on a particular ward, there was a patient who would only really present around the holiday times
Mm-hmm.
because of Junkanoo and preparation for Junkanoo. So
Wow.
not sleeping, not really taking care of himself, probably drinking a bit more than he should,
Mm-hmm.
smoking marijuana to be productive in the shacks. And so he would actually present at least that around that time, and that it seemed related specifically to the holidays. But you do get people who would come in and present
Mm-hmm.
who have been grieving and probably having a lot more difficult times around
The
the holidays
holidays.
and approaching the holidays. Sure.
Yeah. That's very sobering, by the way.
Yeah.
Can you identify any early signs of holiday stress, anxiety, or depression? You can take whatever is
Sure.
coming. Mm-hmm.
So grief
Mm-hmm.
is sometimes a little difficult to differentiate from depression.
Right.
So when a psychiatrist speaks about major depression, we're talking about somebody who is persistently sad and low most days of
Right.
or every day of a 2 week period, along with a number of other criteria that we look for.
Mm-hmm.
Grief usually comes with some positive memories and feelings about the person specifically or people specifically that you've lost, whereas in major depression there's no positivity. A lot of times it's just more negative feelings and thoughts that the person is having, and and a feeling of worthlessness that you would not necessarily see in somebody who's grieving.
Mm-hmm.
Also with grief, many times people are able to function and to cope,
Right.
and that's what we try to get everybody that's grieving to do,
Mm-hmm.
to learn how to function and cope despite the grief. But when depending on the severity of depressive disorder, anxiety disorder, there is that inability to function and cope.
Mm-hmm.
So some of the early signs that people may have are problems with sleep.
Okay.
So that tends to be an early warning symptom and sign of so many different illnesses, but that is definitely an early sign. Or just a feeling of being low. Men typically do not present as, oh, I feel sad or I feel depressed. With men, what they may notice is a decreased interest in things that
Yes.
they enjoyed. So not wanting to play video games, not being interested in sex like they were, um, not wanting to hang out with friends, and so their loss of interest, which is one of the criteria for a major depression. But with men, they tend to notice that more than actual low mood. But low mood and changes in mood are some of the early signs and symptoms as well, or anxiety that just persists.
Mm-hmm.
So normal anxiety happens when there's an obvious trigger,
Right.
and something like you're preparing for an exam or you are about to give a speech in front of a number of people. So there's an obvious trigger, and once that trigger is removed, the anxiety resolves. But for somebody who struggles with anxiety and has an anxiety disorder, that anxiety persists. So despite there not being an obvious trigger,
Mm-hmm.
the person still has all of those feelings, symptoms, signs of anxiety. So, I mean, I could go on and on about early things, but sure, some of those
I think those are.
changes.
I think when you think about the lack of sleep and sleep
Hmm.
health,
Definitely.
and then being disinterested, particularly around such a social time,
Hmm.
I think they were very clear
Sure.
indicators. How can someone distinguish between, say, normal holiday stress and then something more serious like clinical depression or anxiety?
So it again, it's your ability to bounce back, for lack of a better term. So you feel the stress, you feel the pressure, but when things start to resolve, you're not feeling that heaviness anymore.
Mm-hmm.
But when that persists, despite a lull, then you have to be concerned that it may be something more. So when your mood is persistently low or depressed, sad, despite everything else that's going on around you, you don't want to interact with people, which may be a big change for you. Not a change for everybody, but for some people, when you're just not wanting to engage with people, you don't want to do the things that you normally enjoy doing. Your sleep is affected, your appetite is affected, so you're losing weight when you're not trying to lose weight, or you're finding it very difficult to concentrate.
Mm-hmm.
And if it becomes severe, then you actually start to think about, people would be better off if I wasn't here, or I would be better off if I wasn't here. Well, have thoughts about actually hurting or harming yourself.
I know that I guess when somebody is, I ask a question because I want to figure out like how long should one wait. I know sometimes I can get into a space where
Sure,
I'm low.
sure.
I just feel low, right? And then but they don't span for say more than 2 weeks, maybe a
Okay.
week. And I wonder if there's a kind of timeline that they should be aware
Uh,
of.
So definitely for something like major depression,
Mm-hmm.
our time frame is 2 weeks.
Two
So
weeks.
2 weeks or more.
Okay.
For something like generalized anxiety, you're talking about something that's going on for months, up to 6 months or more.
Mm-hmm.
So yes, in psychiatry, we are looking for certain time frames
Right.
because, as you noted, low mood or change in interest that is happening for days is going to be very different from something that's happening for weeks
Mm-hmm.
and months. So you don't want to let things just go on. I would definitely say if you're having significant symptoms or what feels like significant symptoms for more than 2 weeks, you should have an assessment. Anxiety, people tend to actually present much earlier because they're having a lot of physical symptoms sometimes. So
Mm-hmm.
they're presenting with chest pain, lightheadedness, dizziness, hot flashes, tingling in the hands and feet. They will present to the doctor, sometimes present to the emergency room. And what is telling is when you have all the workup known to mankind. So you have all the blood tests, chest x-ray, echo, um, CT of the brain, CT of the abdomen, and there's no physical cause. A lot of people don't like to accept that it may be something like anxiety because they feel like something has to be physically wrong. But I tell people, if you go in and you have the $1 million workup and it all comes back normal, then we have to start to think about something like anxiety.
I always find it interesting how physically we look for the symptoms, but mentally we don't.
Yes.
And we don't acknowledge them, even though we may possibly feel it.
Mm-hmm.
I'm all about awareness. I love self-awareness. And I think for me, What we're wearing.
No, no problem. A little varying is good. A little varying is
I
good.
love like what how does one build the self awareness to make to be aware of when they are, I guess, slipping from their typical presentation of their I guess fullest or okay self.
If I could answer that question,
I know, right?
I would be
A millionaire.
not sitting here. Not sitting here. I would be in Bali.
Me too.
So
I get so excited.
we don't have we don't have a good
let's work
answer for
together.
that.
Let's work together.
Listen,
let's work together.
let's come up with that plan. Let's
We
come
can-
up with that
I
plan.
got you. You got me.
Please, please, because the plane is calling me.
Yes.
Well, let it hit the bank account first. But no, that's because what you're talking about is something called insight,
Mm.
and it's a person's ability to first understand that something is wrong, to accept
Yes.
that something is wrong,
Yes.
and then the willingness to seek treatment and to take the treatment that is recommended.
Mhm.
So we do not.
We're working on it.
Yeah.
We're working
That's
on
that's a work in progress. And anybody who is really working on it, let me know, please, so I can
Yeah.
get in on that.
Yeah, we're
But-
working on it.
Yeah, but a lack of insight, unfortunately, happens for so many people.
Mhm,
Yeah.
mhm. And I think it's important. I talk about self awareness all the time because I know what it is. Like I'm so, and I love being around people who are self aware because when you're self aware for yourself, you're also self aware for everybody.
Sure.
You're also aware for everybody else.
Yeah.
Yeah. So what are some evidence based strategies for managing stress during the holidays? Would you say?
So, the American Psychological Association, because psychiatrists can't take, we can't say that we do everything. So the APA, the American Psychological Association, has actually come up with some evidence-based strategies for stress management in general.
Okay.
And those would be things like meditation, journaling, exercise, good diet, good sleep hygiene, which many of us, myself included, ignore. Not relying on substances is a very, very important one. So those tend to be some of the general evidence-based strategies. And spirituality. I'm here on a Bahamian podcast, and Bahamians would persecute me if I don't mention spirituality.
Oh, yeah.
It is there.
It's,
it-
it has a point. It's a space.
Yeah, definitely is important. But we can also be overly preoccupied with that particular area. So I tell people, it is important. It has its place, but we also have to move away from the whole idea and concept that if you have symptoms of mental illness, especially severe symptoms of mental illness, so you have psychosis or you have symptoms of mania, that is not demon possession.
Yeah. I like to encourage people to use all of the modalities.
Yes.
Not
Yes.
just one.
I think that's what I need to stress more when I give
You
these
say it
talks.
before you.
Yeah, before
When they
I'm
get you.
ostracized by an entire religious community,
Yeah.
that it does need to be a team approach.
Yeah, it
and
is.
because you have a mental illness, that does not mean that you cannot be spiritually and or have a religious
Or function.
identity. Yes, or exactly.
Mhm.
So those are very important. But I don't know. I don't want to skip ahead of myself, but you did ask about tools to manage around the holiday time.
Yeah, what like some that are specific. 'cause
Sure, sure.
During the holidays, everything is turned up.
Yes.
People at your house.
Yes.
The amount of time you jump in your car to go to places. And
Yes.
so it can be. I know that it can be difficult to find a moment
Sure.
to stress release.
Yes.
So what do you think Can
So I have my list.
read the
Because if
list?
I have my list. So one thing, and I put this first because it was first on the slide that I actually had for a presentation I gave.
Mhm.
But I find myself doing this, and I should not be doing this, is dwelling on ideal holidays of the past. Because I
Mm.
grew up with some awesome, awesome Christmas
Yeah.
holidays.
Yeah.
Awesome. I had an uncle who was not a blood uncle, but more than a blood uncle.
Mhm.
And he would throw magnificent Christmas
Soirees.
Day, yes. And it would be full of the carols and
Oh,
it was
yes.
just a wonderful, wonderful
Yeah.
time. And so we've lost him and lost a lot of significant other people in that group.
Mm.
And so I don't know for what reason, but this year I've been thinking about that a
Mm.
lot and
Mm.
dwelling on that. And so they're saying that you really should not dwell on ideal holidays of the past. The other one is setting realistic goals, and I think that comes kind of hand in hand with the overspending, because you should not
Yes.
overspend.
Yes.
And I, that again I struggle with. So I'm a psychiatrist, and I can openly talk about my struggles, but
Mhm.
making sure that you don't overspend during the Christmas holidays, because there is
There's the after.
so exactly.
There's the
So
after.
exactly. So in January, which is the longest month of the
Only
year,
because people overspend.
which is 365 days long, then you feel it. Exactly. So you have to watch your money, what you spend. You have to set realistic goals for yourself. So you may want the house to look like what's the an architectural what's the
Architectural digest.
cover.
Yeah.
You may want it to look like that, but if you don't have that champagne money, you
Yeah.
better go and
You better go
buy
get
the-
some prosecco.
You went to Prosecco. I went to say peach schnapps. $7 peach schnapps.
on Butter Friday.
Then
We
look where
having
he
too much
gone.
fun.
Look where he
This is the
gone.
last one.
So that is very important. And then you have to pace yourself.
Yes,
So
you
you
do.
cannot. Well, when you're younger, sure,
Yeah.
you could do a lot. When you get my age, not old, but my age, you can't go to every party Wednesday, Thursday, Friday, Saturday, Sunday you will not survive until January.
I just want an abundance of rest. That's all.
Yes.
That's all I
So
want.
you have to get rest, and it's very important to be mindful of your sleep and your sleep patterns and your sleep hygiene. Sure, you're gonna have the nights when you're not gonna be able to get to sleep, but that should not be consistent, because that could be problematic.
My auntie says moderation and moderation.
Agreed. I like that one. Agreed. Definitely. So and then there's also not drinking too much.
Yeah.
So that's an important one, because we love our alcohol. I love to tell people Bahamians, we're horrible when it comes to alcohol intake.
Yeah.
Because I can tell friends what the books say in terms of drinking for an adult, which is 2 drinks in a 24-hour period for women and 3 drinks in a 24-hour period for men. And they will all tell me that they don't care what the book says, that does not apply to Bahamians.
We have our own metrics.
So I'm like,
It seems.
do the research. Do the research. Anybody can do the research and let me know. But not drinking too much, not smoking too much, or not smoking at all.
Right.
And just finding inexpensive ways to enjoy ourselves. John Canoe is one of them that we want to sit in Rawson Square, but when we can't, there you can still enjoy John Canoe.
You can.
And
A second lap. That's what I come.
Unless you have my son in tow, and he complains about the sun is too hot and it's too dirty.
I like to go in the second lap because when the sun hits those costumes, it's the most beautiful thing ever. Also, I can't stay up too late.
I actually prefer it when the sun is down. I
Yeah.
haven't been in years, so I haven't seen it in years with the sun down. But the two times that I've tried to go out, like in the morning
They're
or early
really-
morning, I don't enjoy it as much as I don't know what it is, but I like
you know
it.
what it is? It's the heat.
Mm.
I think it's the heat. Like when you go down the Bay Street and it's already hot out, the sun is rising. It's the heat. I think it's the Junkanoo is a very multi-sensory
Yeah.
experience. It's the music, it's the smell, it's the visuals,
Mhm.
and then it's also the weather. The weather is the cozy part of it. You next to another babe and you don't even know. I ain't never see you again.
No, that's true.
But you
That's
just
true.
love that
Yeah.
that whole cultural experience that you have when you go down the Junkanoo.
Yeah.
We can be talking about this. This the last one.
We back on track
We're
now.
back on
We're
track.
back on track now.
So,
Hmm.
are there any others? What'd you say?
I think, and then
You
reaching out
exhausted.
to family and friends. So that
Yes.
is important, and sharing tasks with them. So it can't be one person. I hope my mother never gets never gets to listen to this because she's cooking 90% of the Christmas meal. But you should ideally
You
share
contribute.
tasks,
Yes, yeah,
with family and friends.
Yeah, I had a Friendsgiving 2 days ago,
Oh,
and I asked my mom to do the turkey and the ham, and that was it. And I did the mashed potatoes. I can't cook rice. I had to.
Yeah.
She had to do that.
I,
For
well,
me.
in our entire meal, I am doing the macaroni, and I think my sister might be doing the salad. And that leaves everything else to our wonderful, wonderful, wonderful mother.
I'm gonna be straight this Christmas. But someone, do we just get back on track?
Sure,
I love
yes.
talking to you.
Yes.
You gotta come back. But someone experiencing loneliness or I guess isolation during the holidays, what are some coping strategies that they can use? I figure that these would be the same ones that you
Yeah,
said
so
before.
a lot of what I mentioned before, but it is lonely for some. I talk about my family. You talked about your mother, but there are some people who simply do not have that.
Mhm.
So we all crave though that social interaction. So there are opportunities to get out and to meet people. There are all sorts of activities. That's what I like about the Christmas holidays. That there's a lot going on
Yeah.
in a place where you don't usually have a lot going on.
Yeah.
So there are opportunities to get out there and to meet people or to reconnect with people that you've not had good relationships with.
Yeah.
Don't force it, but there may be an opportunity to rekindle some important relationships in your life.
And I think the Christmas time lends itself to forgiveness.
Mhm.
The holidays lend itself to forgiveness, where
Mhm.
you could try.
Yes.
Don't
Exactly.
overextend.
Exactly.
But just try and see
Exactly. And that's the expectations too. It goes
Yeah.
back to, you have to manage your expectations of the
Mhm.
season. You have to manage your expectations of what somebody may be willing to reciprocate in
Yeah.
terms of their feelings and emotions. So
Especially if y'all haven't been doing the work
yes.
together. I
Yes.
think that's important too.
Yeah.
So just to lead into that, actually, what advice would you give to someone spending their first holiday season without, say, a loved one who aren't as fortunate as you?
So you should allow yourself to feel what you feel. And if you don't feel good, you don't feel happy, then you give yourself some grace because you are allowed that, especially if it is a loss within the last year or so.
That's important.
But even some people who've lost people 10 years ago are going to be hit really hard. So it's just important to allow yourself to feel how you feel and to process the grief in a healthy way. And then it's reaching out to the family and friends that you do have, and making some time to spend with them. You could set boundaries. Every day is not going to be a good day. Every day is not going to be a day that you want to spend with people, but we should try to force ourselves to get out of the house, and first bathe and put on clothes and get out of the house and to do something, even if it's just to go to the mall and walk around. And when you run into somebody, hey, how you doing? I see you in a long time. And you go and you just, and just kind of people watch and maybe get an ice cream, but try to get out of the house and do some things out and about.
I don't think that anyone loves their house as much as me, though. And sometimes I find myself like getting so comfortable on that it's like, Eddie, you have to get out of this house. You absolutely have to.
You do.
Because it can be you stay there.
Yeah. And with people who do suffer from depression and anxiety, I don't do therapy, but I do know enough that you don't give into it. So you don't give in. You try to fight that feeling of just being alone, isolated in the house, in the bed. You do have to push yourself, and it's going to be uncomfortable. It's not going to be something that you enjoy doing, but it is going to be helpful in the long run.
Yes. Yeah. We're in studio today with Dr. Rashida Brown-Clarke, a psychiatrist, at Doctors Hospital within the Doctors Hospital system. And we're going to take a short commercial break, and we'll be right back.
Experience the immediate care you deserve at Doctors Hospital Urgent Care. When emergency strikes, trust our expert physicians for fast, quality care. With extended hours and cutting-edge medical technology, we're always ready to serve you. Don't wait or take risks with your health. Visit our urgent care suite at Doctors Hospital West on Blake Road for immediate, trusted, and best care.
We're back, and we're in studio today with Dr. Rashida Brown-Clarke, a psychiatrist here within the Doctors Hospital Health System. We're talking about mental health during the holidays, and this is part 2 of our holiday health series. Dr. Brown-Clarke, I want to ask this question because family is the time you spend more time with your family around the holidays than any other time. And so So these gatherings can sometimes, trigger conflict or heighten emotions. What are some strategies for setting healthy boundaries with family members to protect your own mental health?
Sometimes it can be very difficult, but you have to maybe limit the time that you spend with family members and maybe even before a gathering, depending on who you expect to be at the gathering. You may want to find out who's going to be there and decide, okay, I'll sit this one out.
Because I don't want to be triggered.
I don't want to put myself in a situation where I will get out of character. So you may actually want to limit the family events that you do attend,
right?
Or if you decide that you will go to the family event, you devise a plan now. I can give them a solid 2 hours. Or I can I can give them a solid 2 hours, and then I have to get home to take a work call or something. So you may want to limit the time that you spend. And also, you shouldn't avoid, though, because I was going to say this is twofold. You should not avoid uncomfortable conversations, but you should avoid escalation. So sometimes there's a time and a place for discomfort. But if you realize that there's going to be escalation, that you probably should avoid. And but at the same time, you may want to tell people, look, I'm not comfortable discussing X, Y, and Z. So if that's off the table, we could be cool.
Yeah, let's chill.
Yeah, and we could get along. So I think those are some of the things that you can possibly do to enjoy the holiday season with family and friends But keeping in mind there are certain things and certain boundaries that people should not be able or allowed to cross.
Yeah,
Yeah.
I think we need to. I actually did that the other day. We had our Thanksgiving, and I felt the conversation going into an area that there would be no return from, and it
Mm.
wasn't terrible. It was just
Right.
like, like when you're playing too hard, too
Yes.
rough. It was one of those situations. I was like, you know what, Eddie? Go to your house.
Yeah.
This is get your food
Yeah.
and go. And
Yeah.
and you know
Don't
what?
leave that food.
No, I ain't gonna leave that. Nah, neither of the plates.
All the plates
All
go.
the plates.
Yeah. But you should know, okay, this isn't going where this needs to go.
Mm-hmm.
If it's not your house, you just leave.
Yeah, it just offers respect to the home,
Mm-hmm.
because when you don't want to go in there, bulldoze and then leave. 'Cause I
Exactly.
think, and then you're not invited to the next one.
Exactly. Exactly.
We're talking about something that's really important to me, which is self care. And what are some of the most effective self care practices during the holidays that can promote long term mental health?
Setting a budget.
Say that again.
Setting a budget. And I have a friend who is going to hear me say this, and she is going to kiss her teeth at me because she is going to say, what budget you had for the Christmas. But I do have a budget. Do I stick to it? Not always. But you should set a budget, and you should try to stick to it as much as possible. And that's for everything. That's for the decorations. That's for the gifts. That is for the entertainment.
Yes.
Everything should be budgeted. Because, like I said, January is a month with 365 days. So if you are paid at the end of January, which I was for 20 years, that takes a long, long, long time to come.
I felt that one year, and I was just like, I felt like I was in a desert, no water in sight, and as soon as that touched my account, it's me.
The longest month
the longest
in
month
the
ever.
world. So that is very important. And then taking time to do things for ourselves. So we tend to do a lot for other people during the Christmas times, and you should. Giving is wonderful at this time of year, but you do have to take time to actually do things for yourself, and that could be simple. That could just be relaxing in a bath at the end of the day. Nowadays, but they have the bath bombs, so whatever the fancy things are that they put in the water, and just spending time by ourselves at home and outside of the home. Bahamians don't really like to Bahamian adults don't really like to spend time alone outside of the
I find that
home.
too.
Yeah. I've only really noticed that, I think, as I got older, I appreciated that more and more, that you always feel like you have to be with a partner, with a spouse, with a boyfriend, a girlfriend. You have to be out with friends. You can't. But I enjoy now taking myself out to dinner.
Oh yes.
Or
I go to the movies all the time.
Or the movies by
all
myself.
The time. I don't have
it.
I don't have to talk to nobody. My popcorn is my popcorn.
I don't have to share my popcorn. I don't have to share my drinks.
No, my gummy bears are mine.
So those are things that we should enjoy. We should enjoy our alone time, and then just not abusing our bodies with too much food, not abusing our bodies with too much alcohol. Smoking in general is not a healthy habit at all, and if you indulge in other things is probably even a little worse. So just making sure that we are taking care of ourselves, our minds, our bodies, and our souls. Yeah.
I love the opportunity. I relish every opportunity I get to spend alone, because I feel like we are social beings, and we're typically meant to be around people all the time. We around people at work, around our families. But I always have this in my mind. I think your body is your first home.
Yeah.
And you have to get comfortable in that. before you go anywhere else.
Definitely.
Seeking comfort.
Definitely.
I just have one more question,
Sure.
and it is, what advice would you give or do you have for people who are feeling guilty about not being able to enjoy the holidays in the way that society expects?
Don't
Yeah.
feel guilty about it. That's the most important thing. Everybody is going to celebrate or do things in the way that they want to, and that they should. And if you are unable or unwilling to participate in everything, then don't feel guilty about it. Take the time that you need to reset and to focus on you, and then to come back to focus on the people that you love, and that are around you, because there is something to be said about taking a step back and being a little selfish and working on ourselves. I tell patients, relatives all the time, if you pour everything into someone and you leave nothing for yourself, you go dry, and then you can't help the person next
Anymore?
to you.
Yeah.
So we have to be able to step back and be a little selfish and work on ourselves and take care of ourselves.
Iana Van Zandt said, "It's not being selfish; it's being selfful."
Okay.
And I love that so much because her and Oprah, they one-on-one, and they're always talking about filling up your cup and then everybody else receiving the excess, the thing that overflows. Everybody's meant to have your overflow, so you're meant to fill yourself up.
Definitely. Okay, that's a good one. Self-full. But that's what you do.
Same thing, same concept.
That's what you do.
Yeah,
that's
you have
what
to
you
fill
do.
yourself
You
up.
have to take care of yourselves before, like the oxygen mask. You put on yours first, and then you seek to help others. Yeah.
I just want to encourage everyone to, again, take care of themselves during this holiday season and extend grace, care, and love to themselves first and then to everybody else.
Sure.
Because I think that's important. And when we think about how society requires of us to be what we see on Instagram and what we see on television, and
a perfect life that does not exist.
That does not exist. We have to look within. Dr. Rashida Brown-Clarke can be reached at clinics.doctorshouse.com if you want to schedule. How long are you going to be in office?
For the holidays?
For the holidays.
So my last day in office is the 23rd.
Okay.
But I'm right back. So I'm only out for, 4 days of the work week. And then I'm right back there. Let me not make eye contact. I'm right back there the following Monday.
Okay.
Yes. And then I take a little bit of time in January, but I'm about 2 weeks after the holidays.
All right. But if you want to get in contact with Dr. Rashida Brown-Clarke, you can find her within our system at clinics.doctorshouse.com. I want to thank you so much for this conversation.
Thank you.
I had a really good time.
Thank you so much for inviting me. I sometimes feel a little reluctant because I don't know what I'm walking into, but I did totally enjoy this. Thank you for having me.
It's been an honor and a pleasure.
Thank you. Merry Christmas to everybody out there.
Merry Christmas to everyone. Thank you everyone for listening to the Doctors Hospital podcast. On behalf of myself and producer Gali, thank you so much for joining us and have a happy holiday. And remember, the hospital is still going to be open. We care by providing trusted, best care now. Happy holidays, everyone.
Experience the Bahamas' top provider of physical, occupational, and speech therapy services at Doctors Hospital Rehab Center. Visit one of our 2 JCI accredited facilities, where we offer optimal patient safety and quality care for your healing journey. Let us rebuild and restore your health, mind, and spirit in a supportive environment with specially curated massage and exercise therapy services for newborns to senior adults. Doctors Hospital Rehab, where your wellness is our priority. Schedule an appointment at 302-4636 or 805-1204.